And welcome to the
Sisters in Medicine. On today's episode of Sisters in Medicine, we're going to talk to you guys about the importance of interprofessional collaboration with other healthcare professionals.
Yeah.
What do I mean by that? Well, you know that we're all doctors or en route to be,
Yes.
and our career of choice is pharmacy. But it's very important that we are establishing relationships and communication with nurses, medical doctors, and other healthcare providers as such. It's the only way to achieve positive health outcomes. So I guess we'll kind of just start with Amanda and discussing your experiences as a pharmacy student.
Yeah, very exciting.
And your experiences thus far.
Okay, yeah. So basically my experience with other students in healthcare more stems from attending classes and interacting with them, bouncing ideas off of each other, learning from them, whether it's studying or joining organizations. So my roommate, she's actually studying to be a nurse.
Yeah.
So she's a nursing major.
That's nice.
And
That's cool.
her and I, we found.
What you do?
Hey. Her and I, we joined a club called the Collegiate Health Service Corps.
Okay.
And
what do you do there?
So that organization they pride themselves on helping diverse and underserved communities and teaching them about health.
Oh wow.
So through that
a lot.
organization, we are able to interact with other students in healthcare and just kind of mix and mingle and learn from each other. So you know that's basically the basic level of before getting into pharmacy school, kind of interpersonal connection. And I really do see the positive potential for working with other students.
So let me just ask you a quick question. What do you think, and I know this is off guard, is the number one benefit of having a roommate that's a nurse, being that your ultimate career is to become a pharmacist?
I do see that because we do take similar classes, it is a lot easier to, ask for help on topics that we don't understand in class. Like, if I understand action potential and she understands, I don't know, chemistry, she can, teach me something and then I can teach her something, and it's just a great cohesive environment.
Yeah.
And we can
That's awesome.
work with each other and just like
love that.
create a bond.
I love that.
Yeah.
The reason I mention that, guys, is because it just goes to show. These relationships are so important. It's bigger than even just the exam. But if that relationship continues when you guys both become registered pharmacists and registered nurses, the same way you're bouncing off of each other right now to pass the exam is the same way you'll bounce off of each other to achieve better patient health outcomes.
Right in practice.
There you have it.
Seriously.
And kind of going off what
ahead,
Amanda just said,
yeah.
Ashley here. So as a third-year student pharmacist, I found it really beneficial to work with other programs and other professions. In addition, as a member of the Care for the Underserved pathway, which is also known as Cut Scholars, similar to Amanda's program, they focus, and their mission and focus is on helping under-resourced populations in rural areas. So what we do in that program, so what they do is they they select students in all healthcare programs, whether it's PA, medical students, pharmacy students, nursing students, PT students, OT students.
So it's like a collaborative
That's the definition of interprofessional.
I love that.
And we come together and we literally go to meetings, but also we're required to perform different functions together and different simulations of working together to improve patient outcomes. And what I've noticed is that from the simulations I've worked on and the things that I've done and the experiences that I've seen and a lot of the exposure I've gotten within the program, that it does really reduce medical error. Like, it literally prevents mistakes because you get to learn from other professions on what they actually do. Because I know coming in, they're like, oh, a pharmacist? What do you guys just do? Like, make sure.
What's the point of
What's
it?
the point?
Yeah,
You guys are just here for what? The medications? Yeah, we're here for the medications because we're medication experts. And working together early on in your practice allows for you to teach other professions about how important your work is. And also you get to gain the knowledge about what they do.
And I got a question for you.
What's up?
So, with all this experience with other interprofessional healthcare teams, especially as a student, what would you say has been like the greatest or the best benefit from getting the opportunity to work with these other professional relationships?
I definitely think one of the top benefits for me has been creating these bonds and these connections with other professions. I have a couple friends in the medical school program who I probably wouldn't have gotten to know or even have met without being a top scholar. And once you get to know these students, they're not, how they like to say, doctors are arrogant and whatnot. They're not arrogant. Like, they actually go through a very rigorous program, much like pharmacy students do. But getting to know them on a personal level has been really beneficial because you just get rid of that
You break
stigma
down
and
the
that
barriers.
stereotype.
Yeah.
Yeah, so it's like I met a lot of comm students that I'm close with, College of Medicine. I met a lot of dental students that I'm really close with.
Nice.
And I think the best part about it is just creating those connections for the future. You know, because ultimately when you finish school, you know, Andrea can attest, when you finish school, the most important aspect about it is getting a job. So I just think that building those relationships with people that are also becoming professionals has been great.
I think
That
that's
was a really good question.
No, yeah, I had to ask that because I think that's great because they say it takes a village to raise a patient, to raise a child.
Oh, really?
But it no,
Raise
they say it
patients.
takes no, sorry, it takes a
Hey,
village
might
to
as
raise a
well.
child. They say, all right, I'm sorry, I got it wrong the first time. I want to be the first. But it takes a team, I think, to successfully get a patient to reach their outcome. And it takes a strong team. In order to be strong, I think you have to be able to utilize each other, and that starts with knowing what each other's skill set is.
And then also to add to that,
ahead,
it starts with respect. You
Exactly.
have to be able to respect each other.
Differing opinions.
Yep.
Yes.
And you can speak to that probably very
Yes.
well,
Right.
Because you're a P4 mommy over here.
connotations and actually
Oh yes,
submerging
I
that
can
into it.
definitely speak to that.
Yeah.
Just going off what Ashley and Amanda both said, I've definitely had a ton of interprofessional events during my time at my School of Pharmacy, and my program's actually really unique in that we also have like a dental hygienist program, a nursing program, a diagnostic sonography program. We have so many programs, so I've been able to interact with a lot of other students and I've been able to teach them what pharmacy does and learn what they do, and it's really great. Last event we had actually was on Narcan and how to administer it. You know, with the opioid epidemic going around, each of us were able to talk about, you know, our role in administering it. Obviously, pharmacy has a big role in terms of the fact that we have it over the counter in our community pharmacies, and you know, you'll see it in the emergency room at hospitals.
But real quick, what is Narcan?
Oh, Narcan is an opioid reversal agent for when you overdose on an opioid agent or heroin, anything like that.
So opioid agents, like if you overdose on like
Oxycontin,
Oxy.
oxycodone, fentanyl,
Yeah.
anything like that. So yeah, so we just had an event about that. But you know, being a P4 on my rotations and lucky enough to do all my rotations in one large academic medical center, since I'm doing a longitudinal program, it's been really amazing being able to interact with healthcare professionals like face to face when I go on rounds on my internal medicine rotation. I
You
have
seem
so much
relatively
fun.
excited.
Yes, I love it. That's exactly what I want to do. I actually
Exactly.
just finished applying to residency, so we'll see how that goes. Fingers crossed. But I have to enter the match. That's a whole nother stress. But on rounds, I absolutely loved it. Like having the doctors look to you like, okay, Anne-Marie, this vancomycin dose came back, or this vancomycin trough level came back. That's like the serum level. You know, what do we want to do? It's outside
Real
of the
quick
goal.
disclaimer: vancomycin is antibiotic.
Is an antibiotic used?
She
I'm
was
sorry, I
getting
get
to
so
that.
excited.
Let
It's
her
an
speak.
antibiotic used for like common gram-positive organism infections. Like I don't know if you've heard of MRSA. That's a pretty common one that a lot of people staph or is. So yeah, just having the doctors reach out to you, asking you dosage adjustments based on like the levels of the medication in the body, asking you about side effects. You know, I've been asked to go look into the literature about using an agent in a pediatric patient because there were no studies on it, and I had to, you know, give my expert opinion with the pharmacist I was on rotation with, my preceptor, to the doctors, and you know, they were really relying on us. What do we do about this pulmonary embolism? That's a clot in your lung, a blood clot. What do we do? So it's just been really cool, and even just interacting with healthcare professionals in different meetings. Like on my medication safety rotation, I got to go to meetings with a lot of the higher ups of the hospital, like the CFO and the CMO, the chief medical officer, and we got to discuss putting. There's actually this drug we just got called Indexin Alpha, which is used to reverse bleeding when you use anticoagulants. I'm going so in depth right now,
No,
I'm
but
just
that's
so excited.
so cool.
And
Yes,
we wanted to bring Indexin Alpha on, and there's just all these restrictions with it because
like a
the
PNC?
literature. Yeah, we had a PNC committee. The literature isn't great on using it, but you know, it is the only FDA-approved reversal agent for the new direct oral anticoagulant. So I was a part of the meeting that brought that on to my institution. It was so great being able to interact with other healthcare professionals, but I'm honestly having a great time and I love it. And going off what Ashley said, respect is huge because I do make recommendations that aren't always accepted. And you know, you have to be able to be like, okay, you know, politely disagree. You know, you want to go a different route, that's okay. I'm still here for you. You know, you got to watch your body language and your tone. You don't want them to think you're someone who isn't happy when they don't agree with you, you know, because we're all part of this interdisciplinary team, and you know, we all have to just play our role to help the patient because you know, patients want to be in the hospital, they want to get out, but we all have to work as a team together to help them leave the hospital. So that's a huge part, I would say, the respect aspect and being able to, you know, respect other people's opinions and just work together cohesively. So I've been definitely enjoying my time.
Well, I have a question for you.
Okay.
I do too after her.
Do you feel like the perception of a pharmacist or a student pharmacist going in, the one you had, do you feel like it holds true in the hospital?
As in, what perception though?
The perception of what they do and like how they should be respected, and if they're able to actually provide an impact, you know, to the patient's drug regimen and their role.
I would definitely say, pharmacist role. I would say the institution I'm at, pharmacists are definitely looked at as someone that are super helpful, a resource on rounds, part of the team. Like, I know a pharmacist who works in the SICU, the surgical ICU, and they will not go on rounds without him. Like, they are waiting for him before they go on rounds. Yeah, they are like, we need you, Mike. Oh, well, I said his name, but yeah. They need you.
Good to know.
So it is something that I definitely feel like at my institution, we are a valued member of the team, and the physicians, the nurses, the nutritionists, the physical therapists, they definitely want to hear from us, and they're definitely appreciative of our recommendations and intervention. So I've been all for it.
And just to add to the levels of serum levels of drugs, for antimicrobial stewardship
I said antibiotic stewardship.
In addition to antibiotics, there's other medications that you can take in the hospital that if you don't monitor the levels, it could cause toxicity.
Yes.
And toxicity in patients could kill them.
Yes.
So you
a lot
want
of
to
patients
prevent all of
a lot of
that.
medications for
I
heart
would have
failure.
to actually come to both of you because you both said antimicrobial stewardship. Could you explain that a little bit more? Because it's a little bit,
Do you want to hear? You want me to?
Oh yeah, I'll let you take it.
Okay, antimicrobial stewardship is just a fancy term of saying I'm watching the antibiotics you're prescribing to make sure that you're prescribing them at the correct dose and for the correct duration, because if we use them at too high a dose, that can contribute to microbial resistance, or for too long a duration. Like, say you have an ear infection, you're not going to want them on antibiotics for like a month, compared to if you have osteomyelitis, which is an infection of the bone, you're on antibiotics for like 3 months, and ear infection would be more like 5 to 7 days. So that's just, the ID pharmacist will just make sure, she'll run through all of the antibiotics patients are on whatever floor she's on, and she'll just make sure they're on them at an appropriate dose and for an appropriate duration. Sometimes she'll de-escalate, like, let's scale that dose back.
So antimicrobial stewardship is basically just like almost like a control system.
Yes.
Using antibiotics.
Making sure
the
you're
right way.
using antibiotics appropriately, essentially.
Marie, go off of Ashley, go off of Amanda, and all their experiences. I can really speak to the importance of interprofessional collaboration in healthcare, in this healthcare profession. Yes, I am a pharmacist, and I cannot tell you. Yes, I talk with my hands. I'm Italian.
I do too. I'm Italian.
I'm just kidding. I'm not. No racial issues. Okay.
We love Italian.
We love you so much.
I love Italians.
We know. So
My boyfriend's Italian.
Okay. So honestly and truly, I can speak to this very, very highly because in everyday practice, I can tell you the hindrance on my job that is created when I don't have a good relationship with either the doctor or the nurse or the physician assistant. So every single day I get prescriptions from a variety of prescribers and providers, and they're not all medical doctors. Sometimes they are the physician's assistant. Sometimes they are the APRN, which is an advanced practicing registered nurse. And oftentimes, if I don't have a good relationship, i.e. with the practice or the doctor or the nurse, if an issue arises, maybe a drug interaction or so what I can speak to is the communication environment that is created when you have a good relationship with other interprofessional relationships. One thing I could say is that at one point in my career, I had a very, 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 very strong, good relationship with a certain practice of doctors. And, whenever their patients needed a hepatitis vaccine, or a influenza vaccine, or Tdap vaccine, which is your tetanus vaccine, anything like that, they would send their patients actually over to us because my pharmacy, they didn't have that storage for those vaccinations at their practice. So what I mean by that is that practice worked in relation with me to make sure that all their patients got the vaccines that they needed. It was an interprofessional level of care that their patients got. So if the doctor couldn't provide something, they knew the next healthcare professional to reach out to get them that. And that's why it's so important, because when you're thinking about collaborative healthcare and making sure patients receive the utmost benefit from their health profile, you want a nurse on board. You want a pharmacist on board. You want a medical doctor, you want a physician assistant, you want anybody that you can get on board, because it's tapping into all different skill sets. It's tapping into all different educational backgrounds. And when we come together, we have a stronger foundation for that patient care and that patient plan. So working in the pharmacy, actively, I've seen the importance of having positive interprofessional relationships with other healthcare providers. I would say that I actually go out of my way. I always reach out to the neighboring practices and say, I'm the pharmacy manager in the area. I just want to let you know, if you have any questions, concerns, or comments, feel free to reach out to me. We can bounce off each other and make sure our patients are receiving the utmost care. I always do that because it's a courtesy, because I feel like oftentimes other healthcare providers don't necessarily feel that they have to make those relationships or that collaboration may necessarily be important. but it's the only way for us to make sure we are getting these patients the most effective and the most efficient healthcare possible. When we work together, we achieve better patient health outcomes. So speaking to where I am in my career, I just can say very, very, very highly and how important it is for us, pharmacists, nurses, medical doctors, physician's assistant, anybody who is included in healthcare, for us to be able to come together, intervene together, and make better patient outcomes using the skill set of an entire team, using the advantages and the benefits of the entire team, and ultimately to achieve that positive health outcome. So it starts from the student,
Yes.
goes to the intern, goes to the graduate intern, goes to the pharmacist.
I do have a question for you.
Please, I would love it.
So you mainly spoke about working with doctors or other healthcare professionals that you had a good relationship with. Were you ever met, or have you ever had an interaction with someone where you met resistance?
That's a good question.
And what did you do?
Oh, resistance is probably, and that's why I would have to say that, actually speaking to,
It's not good.
It's not good, even in antibiotics, it's not good. Actually spoke to respect and respecting each other as a profession. And I think one thing that I say that might be lacking, and I don't know because I did not go to medical school, I did not go to nursing school, but I don't know if they teach other healthcare professionals to respect the pharmacy profession as much as they teach the pharmacy profession to respect other healthcare professionals. So I'm not upset at doctors who have found me invaluable. I'm not upset at nurses that want to argue me down about drug interactions. I've seen that plenty of times, and I guess since you're asking that specific question, I'll speak to that. I actually had one experience where an APRN called in a medication for a patient. She was so sure that the patient needed to be on this medicine, regardless of any other factors, regardless of any other situation going on. Now, this was a patient who had suffered opioid addiction in the past. Opioids are narcotics, oxycodone, OxyContin, anything like that. But this APRN was so sure that this patient needed to be on a medication like this. And she called me. I wouldn't fill this prescription for the patient, so I called the patient. I called the patient and I called the nurse. The nurse ends up calling me back, and she was very, very upset with me. Like, why aren't you filling my prescription? Almost like I was defiant towards her. I'm blatantly disobeying her orders to fill a prescription for her patient. I would never do anything against ethics. I work as an ethical pharmacist. Some people might say it doesn't necessarily touch the law ethically. What that means to me is I work to the betterment of the patient no matter what. So when this prescription was called in, and me having my own personal relationship with this patient, knowing the opioid addiction in the past, knowing the addiction potential this patient has had to other medications, I would not fill it. So I called the nurse back and I said, is there anything else we can call in for this patient's pain? The nurse, this is what she decided, was very livid and upset, said, no, this is what we're going to call in, and you need to fill the prescription that I called in. So you're in a predicament, somebody's telling you have to fill a prescription. They're telling you you're supposed to fill it just with your credentials, your license, and put it through for the patient. I asked the nurse, I said, have you been working with this patient long? Is it you have a history? She said, no. They came today here to the urgent care, and this is what I prescribed, and I want you to fill it. And I explained to the nurse, well, unfortunately, it's not that easy.
Wow.
Healthcare has a bigger picture to it. Exactly. And I know this patient personally, and I know this patient's issue with addiction and opioid dependence, and I personally don't believe that this is something that we should be calling in for this patient today. There is a slew of pain medications that we can maybe go to, and I don't think they necessarily need to be on this. She said to me, no, I want you to fill that prescription. What do you do with resentment like that?
You probably.
You always follow your own ethical code. So what did I do? I let the patient come into the pharmacy. When the patient came to pick up, because they knew a prescription was there for them, I said to them, this is what your nurse called in for you today. Would you want to pick this up? It has this dependence on it. It has this addiction potential to it. And I just want to make sure before I dispense this to you that you are okay with this. What did the patient say? She wasn't, Andrea, I don't want it. Is there something you can give to me over the counter that might work?
See? Do what's best for the patient and what's ethically sound.
And you'll always meet the right standards.
Yes.
That's SAM for you. Questions, comments, concerns?
About interprofessional collaboration, let us know.
Let us
This
know.
is medicine for the win.
Subscribe.
Exactly.
We love to hear from you guys. Thank you for everything.
Thank you so much.
Later, guys.
We'll talk to you guys later. Take care.
Sisters in medicine.
Sisters in medicine, sisters in medicine, sisters in medicine. Hey, hey, sisters in medicine, sisters in medicine. Hey, thanks for watching.